Okay, so I'm going to do a quick tutorial on tumor lysis syndrome. So this is my rendition of a very angry, mean cancer cell. So tumor lysis syndrome happens when you give chemo to somebody with cancer. The chemo causes the cancer cell to break open and die, and then it releases all of the contents that were inside it. And so that's potassium, phosphorus, nucleic acids, and cytokines. Okay, and so what happens when all of this enters the bloodstream is you end up with high potassium, high phosphorus, high uric acid, and then also high cytokines, which I'll put here as well. Okay, so the high potassium here causes arrhythmias. That can be problematic. The high phosphorus can cause low calcium. The calcium being low causes issues like cramping, tetany, and even seizures. The high uricemia, we'll talk about in a second. The high cytokines can create like a sepsis-like picture with low blood pressure and like whole body inflammation. The interesting part about the phosphorus calcium combo and the uric acid is that the phosphorus and calcium together can precipitate in the kidney, causing kidney injury. Same with the uric acid can precipitate out into the kidney, causing kidney injury. And so kidney injury is going to be one of the main big problems associated with tumor lysis syndrome. So something you really want to look out for. Once you start to have kidney injury, you're going to have an increasing BUN and creatinine. So the treatment for tumor lysis syndrome is twofold. First, to preserve kidney function. That's one of the main ideas. So to do that, you're going to do two things. Firstly, to increase the GFR to help these things that precipitate out, the phosphorus calcium combo and the uric acid, to help them kind of get through the kidney faster rather than getting stuck. And so to do that, you're going to give them extra IV fluids, tons and tons of IV fluids. And then the other thing you're going to do is give allopurinol, which can help reduce the level of uric acid in the blood to kind of nip it in the bud out here before it gets to the kidney to precipitate. The other treatment for tumor lysis syndrome is also to prevent electrolyte abnormalities. So mainly looking at your potassium and your calcium. So your potassium is going to be too high, so you're going to work on potassium lowering medications. And then your calcium is actually too low. So you want to give small amounts of calcium, just enough to relieve their symptoms of like tetany or seizures, but not enough to create more precipitation of the calcium-phos combo. Okay. The interesting thing about treatment here, we usually talk about treating the main cause. However, the main cause of this was that you're treating their cancer. So it's either treat the cancer and allow this to happen, or don't treat it. So the treatment here is really, for tumor lysis syndrome, is to prevent the complications from it, mainly kidney injury, arrhythmias, and seizures.